Leah Mackay is a typical Duke student, busy studying, going to meetings, and working her campus job. She doesn't feel like she has time to get sick. So when Leah wasn't feeling well, she made an appointment with a nurse practitioner at the student health clinic. She thought she would get better, not worse.
They booked me an appointment with a nurse practitioner. I went in and saw her, and she diagnosed me with like a bacteria thing and gave me an antibiotic for it.
The next morning, Leah woke up feeling even sicker than before.
I'd been misdiagnosed, and that I didn't actually have a bacterial infection, I had a viral infection, and that my body was reacting really badly to the antibiotic because it was very strong.
The idea behind a free health clinic on campus is simple. When you get sick, they provide the diagnoses and treatment. But when doctors get it wrong, students have more than just their grades to lose.
She told me that I actually had 2 viral infections, and that the most severe one in my throat they had just not diagnosed at all. And that if I hadn't come in within the next 2 days, that I would have actually had to go to hospital, have my tonsils cut out, operations, all of that.
Leah went to an urgent care seeking better treatment, but not everyone has that luxury. When Sydney Spiesman had an ear infection, the clinic had no available appointments and told her to go to an urgent care immediately or she could rupture her eardrum.
Yeah, well, for me it's really hard because I don't have a car. And so luckily one of my friends who has a car was able to drive me, but if she hadn't been able to do that, I don't know what I would have done.
When students like Sydney can't be seen, they often have to wait it out and take the risk of getting even sicker. Some point out the irony of attending a university renowned for its medical research and care, but can't better care for its own students. But Student Health Director John Vaughn says even Duke has limited resources and it does the best it can.
It's always that balance of making sure we're available for everybody who wants to be seen, but saying, okay, if we can have one of our nurses check out a student and say, okay, it's probably a cold or something, why don't you try this for a couple of days, we can save our appointment slots for someone who might be really sick. So we're always maintaining that balance.
As for the misdiagnoses, Dr. Vaughn says symptoms change over time and the clinic will not always get it right. But he says the staff is perfectly qualified to diagnose and treat.
We use all of our physicians and nurse practitioners and physician assistants, we're all fully, board certified and trained, so they're all, we're all up to date on all the standards of healthcare.
When the new student health center is built in 2016, accessibility on campus will improve. But some say if the center doesn't hire more doctors, the problems faced by students like Sydney and Leah will continue.